What are heart murmurs? Heart murmurs are extra sounds that the heart sometimes makes along with the heartbeat. They are very common in babies and children. Now, most of the time, these murmurs are harmless and they don't signal any problems. However, for a few children, they're a sign of an underlying heart issue.
Innocent heart murmurs. Now imagine the normal sound of a heartbeat is as a lub-dub, lub-dub, lub-dub. A heart murmur is like an extra noise mixed in with that lub-dub. Luckily, most heart murmurs in babies and children are what we call as innocent or functional. This means they happen just because blood is flowing around through the heart normally, and there's usually nothing wrong with the heart itself. These murmurs often occur when blood flows quickly through the sharp twists and turns of a very small heart. Children with innocent murmurs are perfectly healthy. Innocent murmurs are very common in babies and children, and they come and go as children grow up. They are likely to be heard during infections. Most of these murmurs disappear by the time kids become teenagers, and they usually don't need any special treatment.
Murmurs that can be due to a heart condition. A murmur, however, can be a sign of an underlying heart condition. Some murmurs can be a sign of a real heart problem. In England, about 6 out of every 1,000 babies are born with what's called congenital heart disease. This means they have a heart issue from birth. Now, these conditions can range from something very mild to something more important or severe, depending on the specific problem.
When to get checked. If your family doctor or general practitioner or a hospital doctor isn't sure whether your child's murmur is innocent or if your child shows any of the following signs, they might send you to a heart specialist called a cardiologist. These signs include getting tired quickly, breathing difficulties, bluish skin, especially on the fingers or on the toes, and lips, or feeling dizzy or fainting,